This video will explain how to Microalbuminuria Rapid test at home. A Microalbuminuria Rapid test is a urine test that detects small amounts of albumin in urine, a protein that can leak into your urine when your kidneys are damaged. Before you start, please read test procedure, how to use the test, and interpretation of the results. Before performing the test, allow the test cup to equilibrate to room temperature, 15 to 30 degrees Celsius. The test can be used by women or men, but for women, the test should not be performed during or for 3 days after your menstrual period. The test can include test cassette, color chart, and instruction. Collect urine specimen by a disposable, clean, dry plastic cup. Remove the test strip from the pouch. You have cassette and a dropper. Put the cassette on a clean and level surface.
Squeeze the dropper bulb. Put it into the urine specimen. The urine specimen will migrate into the dropper. Release the 2 drops of urine specimen into the S well. Wait for the colored line to appear. Read the result at 3 to 5 minutes. It's going to be a positive result for microalbuminuria test. The albumin in your urine, more than 20 milligrams per liter. A positive result with the test indicates the albumin concentration in urine is more than 20 milligrams per liter, but does not necessarily indicate kidney injury.